It's great to be here in West Palm Beach at the Rehabilitation Center of the Palm Beaches. And I want to thank the folks we have with us here today, our Surgeon General, Dr. Joe Ladapo. We have Kevin Guthrie, the director for the Florida Division of Emergency Management, our ACA Secretary, Simone Marsteller. We also have Valerie Gray, who's a nursing home administrator here, Ken and Wayne Uffelman, who are going to talk about having received the monoclonal antibodies, Senator Harrell, and then Representatives Caruso and Snyder. Today, we're here to announce an initiative related to at-home testing. As many of you know, the federal government had promised to send massive amounts of that into American communities. Actually promised you could go online, request one, and they would just mail it to your home. That has not materialized, and so we've tried to look and say, where can we make an impact? I know the tests are scarce, but we've been able to work to be able to quarter some. And how would we then use those if we did have at-home tests? So we have acquired, we have the ability to send out up to 1 million at-home tests. And what we're going to start by doing is sending them to our nursing homes and our long-term care facilities. And then beyond that, we'll focus on senior-heavy communities. And the idea is our view on testing, Dr. Ladapo will talk about it, is if you're just young and healthy, you don't need to be running out and getting tested every day. Really, testing is supposed to lead to a clinical result, or what's the clinical response if you have a positive test. Well, clearly, when you're talking about long-term care facilities, you're talking about senior communities, those are the demographics that are going to be more likely to take a positive test and then parlay that into treatment, which we do support and want to get very quickly. So that will make a difference. It makes it better for the elderly. You don't have to wait in a line. The stores, I think, will start to get more in, but they go very quickly, and you have some people that'll buy up a lot of the tests, and it makes it tough. So the people who the testing is going to be very high value for, that's where we really want to see the access to. And so we are doing that, and this really follows from a lot of the policies we've had where we've tried to put seniors first, just recognizing that seniors are at greater risk. Now, fortunately, the Omicron variant is far less pathogenic than the Delta variant or even the previous iterations up to that point. What we're seeing is way, way more contagious. You're seeing it spread way quicker than you've ever seen any of the other variants spread. But the flip side of that is that it is less lethal, which is really good, and really is kind of what you would expect as a virus like this evolves into something that is going to be endemic. It's not something, and I've been saying this for a long time, but it's not something that's going to vanish off the face of the earth. It's something that's going to be here, we're going to live with. But between the prevention, the treatments, the acquired immunity, it'll be something that will not, hopefully in the future, impose really significant burdens on people in terms of clinical outcomes. Now, you do still see some people being hospitalized, but I think what we've seen in Florida is the people that are the most severe cases still tend to be the Delta cases. Most of what we see in Florida is Omicron, but it's not 100% Omicron. So we're in a situation now where we understand the deal here. We understand most people are going to be fine. But if we do have vulnerable, whether it's Omicron or Delta, get that at-home test and then get the treatment, and that's something that'll be really, really good. I don't know if there's any prospect of the federal government following through on what it said it was going to do. I don't even think they have the contracts done for this, and to have promised people could go online and order. That's a very tall thing logistically. I mean, we've worked through a bunch of stuff with the vaccines, with the monoclonals and everything, and some of this stuff is easier said than done. So we see an ability to help, and so then what we're going to do also is monitor the demand, how many other places. So it won't just be nursing homes or long-term care. We'll send them to places like we were at Kings Point when we did the first senior community vaccinations. We can send them to other types of those communities, and then this way they just have it. And again, it's not really to just test, but someone develops a symptom, you go in, you have an at-home test, you can get a result, and then proceed to treatment. And that's something that's really, really good. The monoclonals, we have asked for, I think as many of you know, an increase in the allotment. We got severe reduction back in September. We were using them very effectively. You'll hear from some of those stories here. That reduction made it more difficult for us, but because we were able to do a deal with GlaxoSmithKline, we got thousands of doses to be able to paper through any type of interruptions. We didn't really see very much interruptions with the cuts that we saw because the demand declined very significantly. We had very low prevalence for a number of months. Well, now as you see the prevalence go up, you do see the demand for the monoclonals to go up, and we want to be able to meet the demand for our high-risk individuals, like in a nursing home, like our senior citizens. And so we were told earlier this week from the company that sources it that they were going to source the 30,000 doses that we asked for. Then HHS said, well, wait a minute, not so fast. Where does that? So the bottom line is we're just waiting. We don't know what's going to happen with it. Clearly, there's been a different approach based on what state is asking for it. I think that's very unfortunate. I don't think that should be the case, but that is absolutely the case. New York has 3 million fewer people than we do. They're getting way more monoclonals than we are. And I got a lot of New Yorkers down in Florida as well that we take care of. And we serve everybody. I mean, you get your high risk and you go in for monoclonal. I mean, we're not making you show that you're a Florida resident because we want to help people. So you have all that, but that's just the reality that we're seeing. So we're going to keep fighting to do that. We have the ability to do a site in Palm Beach County, which we will do, Broward, Miami-Dade, Central Florida, Southwest Florida, Jacksonville, you name it. We already have a footprint, but this is a footprint that's only getting a very finite number of doses. And so as the doses increase, we then expand the footprint, accessibility becomes better, and then folks are able to get the treatment that they need. So we're asking for the 30,000. We have the infrastructure in place. We have resources in place. We asked the legislature after the Delta wave, we didn't know what was going to happen, but we said, look, if there's future waves, we want to be able to respond and meet the demand. So they set aside almost $1 billion in the legislative budget committee from October so that we have it. So we have everything we need except for HHS releasing the medication to the state of Florida. But I'm confident we're going to continue plugging away. But in the meantime, where we're not seeing the action on at-home tests, we're stepping in. This is a great start to help the nursing homes and the elderly, and we'll continue to expand in different communities as there's demand for it to be able to get these at-home tests. I want to thank Kevin Guthrie at Division of Emergency Management for working very quickly on this. Also thank Joe Latipo for he's going to be publishing the new testing guidelines. And again, we're a free state. We're not saying you can't. If you want to test every day, you can. We're not going to impose any type of restrictions. If that's something that if you want to go buy every test in CVS, it's a free country. It's a free state. But what makes sense from a clinical perspective, and Joe will lay that out in the memo, but basically the testing really, we want to tie that to outcomes that you're trying to get. And if you're just somebody that has no symptoms and you're not at risk for anything significant, to be going out and testing a lot is not something that's going to be considered high-value testing. Likewise, in workforces, to force someone to be testing before they go to work is not going to be really high-value testing. And I think the danger that you have for it is what impacts that could have on society. For example, we rejected the CDC's quarantine policy at the beginning of the school year and said, if you're symptomatic, absolutely, send the kid home. But if you just happen to be exposed but you're healthy, to deny a child the ability to be in school, that has huge costs that are associated with that. And likewise, when you're talking about the workforce, if someone tests positive on a PCR test but has no symptoms, that may not even be live virus, because you could test positive for a couple months with a PCR test. So that person may not even be contagious and have live virus, and yet they're going to be taken out of the workforce and be home. So that's a huge cost that happens with that. And so having a more targeted strategy I think will lead to better clinical outcomes. It'll make it easier for the seniors to get the test when they need it, but it's also not going to impose some of those costs on the back end that are not, I mean, they're not intentional costs. I mean, people are trying to be helpful with the testing. I don't begrudge that, but at the end of the day, we need to make sure that healthy people, whether it's healthy kids or healthy workers, are able to participate in society. And so Joe has outlined that. He's going to be able to publish that very soon, and I think that will hopefully bring some peace of mind to some folks, because I think when the Omicron started going, a lot of people feel, oh, I got to go out and see if I have it or whatnot. And you really don't in the general circumstances. There may be special circumstances. We've always supported more rigorous testing with staff at nursing homes for obvious reasons because of the environment that you're in. But for the general public and the general, particularly the working age and school age populations, really the symptoms-based approach is the better way. So I'll let Joe Latipo come up here and do it. But we are happy to be able to have secured these tests in the midst of this shortage, and we're also happy that we continue to put our seniors first. Joe?
All right. Thanks, Governor. Trying to keep this apple from rolling off here. Okay, I found a safe space for it. Okay, well, good morning, everyone. The governor has set a model that is just sort of continuing today, which is sensible public health. So, we've obtained tests and we're directing them to where the tests are most likely to have a benefit, which is in communities and environments where high-risk individuals reside. So this is sensible public health, and it's the very opposite of what we've seen over the last 2 years, where, for example, people have made it leadership at the national public health level have sort of convinced people that it's just as important to run around testing middle schoolers and elementary school students as it is to be testing other members of the population, even though their risk is 10, 100, or even 1,000 times higher from COVID than these small children. So this is sensible public health. This is the example that we're setting in Florida, and this is absolutely the example that we're going to continue to set. We are not going to be following completely insensible, wasteful, harmful, ridiculous policies for public health that we're seeing, largely characterized as the policies that we're seeing at the federal level. The governor talked about testing. So I want people to know that what's happening now is what's abnormal. So testing people for a respiratory virus when they have no symptoms on a massive scale is abnormal. What we did before this pandemic is what was normal, which is if you have symptoms, we'll test you. And if you test positive, we'll treat you. Like, that's how it's been. This is what's abnormal, what's happening now. It does not make sense to be running around with swabs testing people who are completely healthy. It sounds radical, but I think if any of you who have kids, that one of the beautiful things about kids is they're so simple with things, and they're honest. If you have kids, compare what's happening with nationally with what we're proposing here in Florida. This is so much more sensible. It's also even more sensible considering the amount of natural immunity that's out there in the community, and the fact that people who have risk factors can make decisions over whether or not they want to accept one of the COVID-19 vaccines. So that's the direction that we're moving to. As the governor said, we're not restricting access. We're just basically sort of unwinding the thinking that the national leadership has managed to unfortunately infuse many Americans with. And it's this notion that if you're healthy, you still need to go to get tested for something so that you can determine whether you're sick. Think about that. So that's our testing guidance. And the one additional thing I'll say is I just want to repeat, we're in the middle of a surge. I've said this very often. It's important to us that people who have risk factors get tested when they have symptoms, and that they get connected with treatment. So, we're expanding monoclonal antibody availability thanks to the governor's leadership, and we're also expanding availability to oral medications, including the Pfizer and the Merck products, and providing some guidance about off-label medications such as fluvoxamine and inhaled budesonide, both of which have shown very good evidence for effectiveness in randomized clinical trials. Okay, thanks.
Okay. All right, we have Kevin Guthrie, Division of Emergency Management.
Thank you, Governor. Good morning, and thank you again for your leadership on this important topic. This initiative, this testing initiative, is just another example of where the division has shown through this pandemic, and as I keep saying, we're built for speed and a very quick turnaround. Less than a few days, we've been able to secure nearly 1 million at-home tests and make them available to nursing homes and long-term care facilities. I can tell you that starting today, each and every nursing home and long-term care facility will start to receive. We will ship those products out today, and they will start to receive them over the weekend. And that will happen. We'll send a first supply, and then we'll allow them to allow the long-term care facilities to ask for additionals if they should need them. And as I have said all along, we are the logistical support arm of the Florida Department of Health and the Agency for Healthcare Administration, and will continue to do that. I think on the monoclonal antibody situation, I do want to let you guys know, at the direction of the governor, yesterday I sent a letter to Secretary Becerra with HHS, letting them know that if they needed any assistance in logistically moving the product of monoclonal antibodies from the warehouses across the nation to the state of Florida, that we will activate our logistical trucking contracts to go and get that product and bring it back here expeditiously. So again, for your leadership, Governor, I thank you very much.
Okay, now we're going to hear from Wayne Uffelman. He's going to talk about his family's experience with getting treatment for COVID. So why don't you guys come up?
Good morning. My wife, Kim. My caregiver, because without her, I don't know if I would have survived. I was very sick. And I guess we got it pretty early in August, late August. And,
my husband got sick first, I got sick second, and my 94-year-old mother got sick third. And he got the monoclonals about 8 days in. I got about 4 days in. My mom got it within 24 hours. It stopped him dead in his tracks with progression,
yep,
right?
Yep, and thanks for opening
Thank
the center.
you.
Straight right around when we got it, fortunately. And it
And
turned.
you did the one in Palm Beach?
West Palm.
West Palm.
Right. And it turned me
your
around.
Mom did where?
Fort Pierce.
Fort Pierce.
Okay.
But it turned me around. I mean, I was really sick. And I had a high fever after the shot, but then the next day I started to come around.
Yeah.
I was real close to going into the hospital, and you don't want to go in the hospital. So, I'm just so grateful.
Yeah. And how did you know about the monoclonals?
We watched the news, but we also went online and looked it up. But
Did
we
some
heard
research?
you. We
Yeah.
heard you giving. We watch it quite often. So,
Okay. Good.
So, and if you find out a lot of stuff, living in Florida is a great place to live.
It is.
Not the
So
only one
can you
that thinks
spell
that.
your name for us?
It's Uffelman, Uffleman. His first name's Wayne.
Thank you.
Yep.
Well, thank you.
Well, thank
Appreciate
you.
it. Yeah.
Thank
Thanks
you so much.
Yeah, of course. And one of the things we saw over the summer was when people would get it, keep them out of the hospital, which is obviously what you want. We had some very elderly and very, with patients with a lot of comorbidities who were vaccinated, but then they got COVID, started developing symptoms, did the monoclonal. Some still got admitted to the hospital, but then they would recover and be discharged, and a lot of times they'd report that the physicians were telling them, had you not done the monoclonal, we don't know that it would have progressed this way that you did. And so the initial goal is just keep them out of the hospital, but if you're admitted, but then you don't ending up on ventilation, and if this is part of what's helping, then that's a big deal. That's another thing that we're seeing that I think is also worth pointing out, and it is a positive trend, is the number of hospital admissions that end up on mechanical ventilation is much, much lower with Omicron than it was with the previous iterations like Delta and Alpha. And the reason why that's important is because if you're not on mechanical ventilation, your chance of recovery is much, much higher to be able to recover and be discharged. Once you get on that mechanical ventilation, that's when you're really in a fight for your life. And so, and some people recover off that. It's not like it's 100%, but man, once it goes, that stuff. So that's I think a fact of an outgrowth of the fact that the Omicron is more of in the upper respiratory, and it's not getting into the lungs the way Delta did, and so that's a good thing to be seeing compared to what we have been seeing. Now, there's also this notion. There was a lab test done like a month ago, and someone reported, "Hey, there's a study. Monoclonals don't work against Omicron." And they said, well, maybe the sotrovimab, which we did buy some, we've used it all. They send us some sotrovimab, but they're like, we don't think the Eli Lilly or the Regeneron works. But, Dr. Latipo and I looked at that, and it's like, okay, that is one data point. That was not a clinical trial. And then we started talking to practitioners who said they have seen Omicron symptoms resolved. And so we think the what we're seeing is probably that the Lilly and the Regeneron may be not quite as effective as it was for Delta, but if it's 50% effective and you're somebody that's high risk, that's something that you would want to see a reduction. So there's going to need to be a lot of different trials, but we don't have the data to definitively say it doesn't work, just as we don't have enough data to definitively say it works just as well. We think it's probably somewhere in between. But if the choice is sitting on the shelf helping nobody, if it's on the shelf, there's a 0% chance it's helping somebody. If we're getting it, even if it's a 30, 40, 50% reduction, that matters. And so we want to be able to provide that for folks. And so the monoclonals, though, of all the things that we've seen, they performed at the level of the clinical trial over the summer. I mean, when people were getting them, you would see it was very common that their symptoms would resolve in 24 to 48 hours and they would not go into the hospital. That was the standard response that we would see with that. And so that was something that was good to see. We'll see now with Omicron. Of course, there's less likely to progress in a serious way than with Delta. So how you kind of figure that out or see when the dust clears, that remains to be seen. But I do think it's inaccurate if people are saying, oh, monoclonals don't work against Omicron. That has not been definitively shown at all. And anecdotally, we do have evidence that people have had positive outcomes. Okay, now we have ACA Secretary Simone Marsteller.
Thank you, Governor. Just briefly, I want to make sure that everyone knows, right, in the state of Florida, we have some 700 nursing homes and some 3,000 assisted living facilities, which is clearly why Governor DeSantis wanted to make sure, and has done from the beginning of this epidemic, or pandemic, I should say, to take a seniors first approach and to make sure that the seniors who are residing in our nursing homes and ALFs have access to not only the vaccines, third doses, boosters, monoclonals when they became available. Because of the governor's Seniors First strategy, Florida led the nation in vaccinating seniors not only in these long-term care facilities but across the state of Florida. And because of the governor's leadership, Florida led the nation as well in making sure that staff and residents inside our long-term care facilities had access to vaccinations and monoclonals. I want you all to know as well, and I'm going to pick up a little bit on what Kevin was talking about, there is an entire structure that is happening behind the scenes to make sure that these individuals get the resources and the information that they need. My agency, the Agency for Healthcare Administration, partners with the Department of Health and the Division of Emergency Management to make sure that we are coordinating our efforts in an unprecedented way under this governor's leadership to get these resources and treatments into the hands of the individuals who really need them. Among the things that the governor has directed us to develop are strike teams. So whether it was with vaccines or the monoclonal antibodies, where there was a need inside a long-term care facility, we coordinated strike teams to come in and deliver those treatments and to make sure that if people wanted or needed to be vaccinated or get the monoclonal treatment, that we brought people in to help make sure that the residents remain safe and healthy. I want to take this opportunity to say statewide what an incredible job that our health caregivers in our long-term care facilities have done over these last nearly 2 years I know it's been a challenge. I have gone visiting myself. I've talked to them, and I salute them. They have done an incredible job keeping our residents safe. And we're going to continue that push with the governor's support, and I thank him for pushing the federal government to get monoclonals in here. We're going to continue to make sure that these resources get to our long-term care facilities for the residents and for the staff. We want to make sure that our residents can be visited by their loved ones. We want to make sure that we're helping maintain the right protocols so that everyone can be healthy and safe. And I want to thank you, Governor, for your work on that regard.
Absolutely. Okay, Valerie Gray coming up. Where are you?
Good morning. Thank you, Governor, for the opportunity to be with you today as you continue your work to safeguard Floridians. I also want to thank Secretary Marstiller and Surgeon General Lapato for their continued support of our state's long-term care centers. I am Valerie Gray, administrator here at Rehab Center of the Palm Beaches. We provide skilled nursing care, including post-acute care and short-term rehabilitation services to seniors and people with disabilities in Palm Beach and the surrounding communities. We are a 5-star rated facility and a National Silver Quality Award recipient. We deliver exceptional care, and while providing quality of life to our residents is our top priority. We are also a member of the Florida Healthcare Association, which represents over 600 skilled nursing facilities and assisted living facilities across Florida. Throughout the pandemic, our caregivers have worked tirelessly to protect our residents and ensure they were well cared for. We calmed their fears in the face of the unknown. We lifted their spirits and held their hands when they couldn't be with their families. And we shared their hugs when they were finally able to reunite with their loved ones. The governor's leadership gave us hope and has helped us persevere over these past 2 years. He prioritized our residents and staff, making decisions that help keep the long-term care community safe. Many of the decisions he made were difficult, but they saved lives. And he continued fighting for our long-term care facilities as vaccines and life-saving monoclonal antibiotic treatments became available. Once again, the governor put us first, and as a result, our care centers are better equipped to manage the virus, mitigate its spread, and protect our residents and staff in the midst of COVID-19 surges. The governor's innovative thinking to make these test kits, the treatments, and other resources readily available to our seniors is what makes our state a leader in this fight against COVID. The pandemic is not over yet for our healthcare heroes who are fighting every day to ensure our residents are safe and receiving the best possible care they expect and deserve. But we know the governor remains committed to helping us keep fighting while at the same time rebuild and recover from the impact of COVID. His most recent Freedom First budget proposal is another great example of that, and with the increased Medicaid funding he has proposed for our nursing centers. On behalf of the thousands of long-term caregivers we represent and the residents who are entrusted to our care, I want to thank you again, Governor, for your leadership and your ongoing support. Thank you.
Thank you. So we're excited to be able to get these at-home tests. You don't have to go wait in line. We're happy to be able to get that to these facilities. And as many of you know, we're a very big state. We've got a lot of these facilities here. So I don't know that they'll need all million of them, but they're going to use a lot of them to start. But we also are going to try to get more and then send them to other communities that may not be a long-term care, but have a lot of need for a senior population to be able to have an easy access to a test that you could just do in your home. Also, just looking at how Omicron has worked throughout South Africa and then in Europe, and then now what we're seeing here is that, it shoots straight up, unlike any viral curve we've seen yet throughout the pandemic. But then when it does peak, it goes down very quickly. And so we're going to be monitoring that here in Florida. I'm not saying that it has peaked yet, but it is likely when it does to turn down very quickly, because you have so many people who are being exposed to it and are getting infected, and most of them don't know they're infected, and that's what will happen. So we'll be monitoring that, but I do think that that's likely the way the Omicron strain will go. In some of the Northeast and some of those, they still have more Delta than we do, because they didn't go through a Delta wave. When we had our Delta wave in the South, they tried to politicize that, but then they've got it in the Midwest and now in the Northeast. And so we'll see how that shakes out. But for us here, we have overwhelmingly, it is Omicron. And if Omicron completely displaces Delta, that in and of itself will save a lot of lives. So we hope that is actually the case. Questions?
Mr. Governor.
Sir.
So I wanted to ask you a question about an interesting situation happened in NASCAR. We have a lot of Floridians that follow NASCAR. They canceled the driver, Brandon Brown, because of his sponsorship with LGB Coin. But on the other hand, they're letting Black Lives Matter sponsor cars. So I just wanted to get your thoughts on that.
I don't think there's anything wrong with LGB Coin. First of all, it wasn't Brandon's fault that any of this happened. If you remember what happened, he was being interviewed at a NASCAR race. There were fans in the crowd who were chanting very colorful language about Biden. And it was obvious that that's what was happening. But then the reporter, I don't know why, ran interference on that and said, oh, they're chanting, let's go Brandon, isn't that great? So that's why it took off, because people are looking at it and say, wait a minute, you're gaslighting us again, and we're sick of it. And so it's as much a rebuke to some of the corporate media out there as it is to Biden himself. But I mean, look, I think part of the problem is there are certain things that were okay. In the last 4 years, you could say whatever you wanted about Trump, and that was fine. And you know what? I didn't complain about it. It's a free country. I mean, it's not always the best thing to say, but fine. Now, all of a sudden, it all has to be sanitized just because the regime doesn't want to have anybody speak out against it. I don't think that's the way we want to go. So I'm very much in favor of letting people speak their mind however they want to do it.
Governor, I have a question about the logistics. I had a question about the logistics.
I have not tested COVID. I've tested recently. When Trump was president, they would test me anytime I'd see him. I've not had to test to go anywhere in an awful long time, and I would only test if I had symptoms. And so I haven't had any symptoms, and so I haven't tested. Yes.
Governor, about the logistics of distributing or allocating these tests to these nursing homes, can you go a little bit more depth as to how many would each nursing home get? How much would it depend on per population? How many times they'd be able to get tested?
Yeah, so you hit the nail on the head on some of those questions. So what we're going to end up doing is sending an allocation based on bed status, on how many licensed beds that facility has. We'll send them for lack of a better term, a starter kit to get up and running. But again, as Dr. Latipo has already mentioned, it's going to be symptom-based testing, high-value testing. So it's not going to, everybody that's in the facility is not going to get a test right off the bat. We're going to do sensible-based approach testing for those long-term care facilities. And then the reorder process will be completely online. We've already got that portal set up so that for instance, people will not have to go from here to the Palm Beach County Emergency Management Agency or the health department. They'll be able to go straight to a portal and ask for an additional allocation of those at-home test kits.
And of the 1 million in Palm Beach County, very specifically, how much of that portion will be allocated?
It'll likely be just, if you look at, Palm Beach has a lot of facilities, and so it'll be on a per capita. So, Palm Beach will get relatively a lot because they've got a lot of facilities, and so it's going to be done that way. I mean, one thing I think is just important to think about as we're doing this, and, they're ramping up now because the shortage of tests, they're trying to get more into the market. If Omicron goes up and down as quickly as it has in other places, you could find yourself with a lot of tests on the market all of a sudden in another month or 6 weeks. And so we want to make sure we're doing 1 million, and if the demand's still there, we want to keep helping. If we can fill a need that a need can't be filled commercially or whatever the feds are doing, we want to be helpful. But through most of right before the last few weeks, there were plenty of tests out there commercially and everything like that. It was really the Omicron and now the big crunch nationally. So we're helping to alleviate that, and we'll continue to do it. But we are going to monitor how the course of this is going, because if it crashes like it did in South Africa or like it did in some of the European countries, you will absolutely see the demand for testing decline. I can tell you, we had in Florida, you go back September, October, November, I mean, there was very, very low demand for testing because there wasn't a lot of COVID going around. Then Omicron came, and when we got into mid-December, you started to really see the demand increase. But I do think that as Omicron peaks and goes down nationally, not just in Florida, that is absolutely going to affect this market. So we want to just make sure that we're responding to fill the niches, but also understand that there's probably going to be a lot of these things dumped on the market, in another couple months.
Governor, about a week ago, Agriculture Commissioner Nikki Freed put out an official statement accusing you of stockpiling COVID tests that were expiring soon. Is there any truth to that? Can you speak to that?
Kevin can talk about what they have at DEM.
Yeah, so what we had, again, to piggyback on what the governor just described as a downturn, and we did not have a demand for testing. We had between 800,000 and 1 million test kits, Abbott rapid test kits, in our warehouse that did expire. We tried to give them out prior to that, but there was not a demand for it. We received a 3-month extension on those test kits, which ended up expiring between December 26th and December 30th. Prior to that date, we did ask Abbott and the federal government for another 3-month extension on those so that we could use those tests. We are still waiting to hear about that from HHS.
And if they do, I mean, I think the thing is, if they're not authorized, if they're not accurate, then we don't want to send out inaccurate tests. But they already were extended in September. There wasn't a lot of demand for them. They've been sending them out as requested. There was no withholding anything, but it's just that the FDA has not gotten back to DEM about whether you can still send, because these are things now, what are they, a year?
Yeah, they're right at a year.
They're right at a year. So initially it was 6 months, and then they extend, and so is it good? These are like some of the original tests that had, and there just weren't a lot of requests in September, October, November. Now that you have more, we would do. But honestly, these at-home tests are going to be better because it doesn't require anybody to proctor the test for you. I mean, you can do it there. The Abbott he's talking about, it's not like I could just send it. So we actually wanted to send a bunch of those to long-term care facilities at the beginning when we got all these. And a lot of them were like, well, if they didn't have staff on hand, they were like, well, what are we going to do with it? Because it comes in a box. There's a bunch of different tests, a little thing, you do it, and you kind of got to, and I know how to do it, and other people, but a lot of them are like, no, if it requires a nurse, then we're not going to be able to do it. Well, the at-home ones are going to be very easy for people to do. So that'll be a good thing.
Governor, have there been any outbreaks at long-term facilities recently, and will that information be made public?
Simone, do you want to? Omicron outbreaks in long-term care, what are we seeing?
Well, I don't have any specific numbers for you now. We are seeing, just as in the general population, we are seeing more cases, right? But to my point earlier, whenever cases are reported to the Department of Health, so to the local county health department, that health department has a healthcare associated team, infections team, that comes into the facility, coordinates with the Agency for Healthcare Administration, and we make sure that we're addressing whatever the issues are, helping with infection protocols. These visits and strike teams happen on a regular basis. And so we want to make sure that we are coordinating, and we are, with all of our long-term care facilities, nursing homes, ALFs, ICFs, right, for individuals with developmental disabilities. All of those facilities are seen immediately by HAI teams and by ACA teams whenever there are cases that are reported.
Governor, can you talk about how you obtained the tests? Which company did you work with, and which tests are they?
I can't, because I don't do procurement. I mean, if Kevin wants to go through those details, he could do it. But I would just say this. When Jared Moskowitz was there, and then now with Kevin, these guys have shown a really great ability to, when it's very difficult to find things, to figure out a way for Florida to be able to get some stuff. I mean, it started off early with some of the N95 masks, and then we had all kind of things that we needed over the last year and a half, 2 years, and so they were able to do it. So I don't know if there's anything special you want to talk about, or just it's standard stuff. I think, though, that because of how good our agency operates, there are a lot of vendors. Like, if they can choose to do business with Florida, they do like to do that because they have a good relationship and they know that how we operate. So I think we probably were able to get more than many other states will be able to do. And I think some of those vendors are like, hell, we'll do it to Florida if you guys want it.
Mr. Governor, how do you break we've been conditioned that everyone needs to get tested all the time? How do we break that in society?
Well, I think so Dr. Latipo is going to put out these guidelines, and again, this is not coercive. Like, if there's a low value test and you want to do it, it's a free state. You can still do it. But the clinical benefit of that for somebody that's healthy and is just going to get tested to figure out whether they're sick or not, that is very low value testing. And so when you have people waiting in line, you just say, okay, if you had high value tests for folks who are more at risk rather than low value tests for people who are healthier and less at risk, then you probably, even with the crunch we're seeing, that would probably alleviate a lot right there. But at the end of the day, when you have an endemic respiratory virus, you have got, the default has got to be you live your life. And then if you end up getting sick, then test to see what it is. And then get treatment if you're somebody that is at risk and would qualify under an EUA for something. Absolutely. But to go and test all the time to just see if you have something when you don't have any symptoms, it's not a good use of resources, but it's also not a good way to order society. Because as I mentioned, when you had kids being quarantined who were healthy, and you see that in all across the country, that's still going on. There's some schools that say you have to test negative to be able to be even allowed to go into school. And the problem with that is you can test positive for an awful long time. So you have kids that are not allowed to go into school who are not contagious, not symptomatic, and yet they're kept out. So that's not good. You have other people, particularly in these critical industries, who could be kept out of work based on an asymptomatic test. And so it's not good for the functioning of society to organize society, the economy, education around asymptomatic testing. And here's the thing. The one benefit sometimes people will point to it is it allows us to see when the prevalence is higher or not. But we can already see that just by looking at visits to the emergency department for COVID-like illness. And you can see when that goes up, the prevalence goes up. You can look at hospital admissions. It would be better if they distinguished between people getting admitted because of COVID rather than getting admitted for something else and testing positive for COVID. But either way, you can still get a sense of the prevalence based on that. So that's really, I think, where we're at. And we did lead on the schools by saying that healthy kids should not be quarantined. It was interesting, in 2020-21 school year, we would have school districts do that, and they were following CDC and all that, but they would quarantine healthy kids who had been, quote, exposed to a case. And it's like 98% of them never ended up having COVID or never tested positive for COVID. So you think about all those school days that were lost based on a testing and quarantine policies, that's real cost. So what we don't want to do is impose costs on society if you're getting very little benefit. Look, if it's something that is really going to benefit, then sometimes you just got to deal with this and may inconvenience people, but it's really been low value to do the mass testing of healthy people. And so again, in Florida, if you are healthy and low risk, if you want to test all the time, we are not going to stand in your way to do it. It's a free state, but it's not something that's recommended. It's not something that's going to provide much of a value for you.
Governor, this latest spike started around Christmas. Why did you wait until yesterday and today to address it?
We didn't. So if you look at the week between Christmas and New Year's, we wrote the letter to HHS about the monoclonal antibodies, because remember, right before Christmas, they said, we're not sending any Regeneron or any Eli Lilly to anybody. And we were just like, it was based off that lab study, even though we had been seeing patients that had good outcomes with it. So we pushed back on that. We got a positive result where they reversed that policy and said, actually, we are going to be doing this. Now, we didn't get as many doses as we wanted to, but we were able to get that policy reversed. So that was a huge victory that we were working on in between Christmas and New Year's. And then, of course, DEM works with folks all the time. So it's just not accurate to say we weren't addressing. Now, I do think that our approach has always been one to be very calm about how to deal with this. There are some politicians that the minute you see an increase in cases, they want to run in front of the camera and they want to start selling that fear, because the fear gives them the ability to exercise more power. And we've seen politicians exercise a lot of power illegitimately over the last 2 years. And so if they could whip people up in a frenzy, then maybe they're able to accomplish some things that they would like to do. That we fear doesn't work in Florida. Joe said that when he came on board in the summer. That's just not how we're operating. And so we looked at the data. I crunched the data after Christmas with Joe. We're looking at it. And honestly, it was positive in the sense of the clinical severity was clearly less than what we had seen in previous waves. And so then we were trying to figure out the extent to how contagious it was, and it is very contagious, and we saw that. And so our view was the best way that we can be of value is to continue to fight for these monoclonals, make sure our infrastructure can receive monoclonals if we do get an increase, which we have done, and then with this ability to help fill the gap with the at-home rapid testing for high-risk populations. Okay, one more.
Governor, today is the one-year anniversary of the January 6th attack on the U.S. Capitol. You obviously were a U.S. House member. Do you have a comment about that anniversary, and do you plan to speak to President Trump today?
So, it's interesting how everything in our society, becomes very politicized. And so today is going to be, honestly, I'm not going to watch any of it, but you're going to see the D.C., New York media. This is their Christmas, January 6th, okay? They are going to take this and milk this for anything they could to try to be able to smear anyone who ever supported Donald Trump. And I just look back and compare when I was in Congress, what event that we faced was the attempted assassination of Republican members of Congress on the baseball game. I actually was on the field. This guy, who was a big Bernie Sanders guy, was definitely a politically motivated attack. Came up, pulled his van, and we didn't think anything of it. We walked out to go to the car, and we came in contact with him. He wanted to know if it was Republicans out there. We get in the car, leave, and then we find out he shoots up a bunch of people. And had you not had the Capitol Police there, you probably would have had a dozen people assassinated. That was like a 1-day, 2-day story. That was not something that the Capitol-based press wanted to talk about. Why? Because it totally undercut their preferred narratives. January 6th allows them to create narratives that are negative about people that supported Donald Trump. Look, if you obstruct a proceeding, all about hold people accountable. If you're rioting, hold accountable. But let's just be clear here. When they try to act like this is something akin to the September 11th attacks, that is an insult to the people who were going into those buildings. And it's an insult to people when you say it's an insurrection and then a year later, nobody has been charged with that. People are being charged with disrupting proceedings or that. I think it's very important, the fact that if this is what you said it was, why are you not charging people? So I think it's going to end up being just a politicized Charlie Foxtrot today. I don't expect anything good to come out of anything that Pelosi and the gang are doing. I don't expect anything from the corporate press to be enlightening. I think it's going to be nauseating, quite frankly, and I'm not going to do it. But I do think that if you have this January 6th committee, why do we not know some of the people who we know were really involved in orchestrating this? They got pulled off the most wanted list. Christopher Wray was asked at the under oath what FBI was involved in that, and he would not answer the question. And so I think that this is something that has really been used for political narrative and posturing purposes. I don't think it's been effective. People here in Florida, they care about inflation, and they care about gas prices and education and crime and all the key issues that are so important. And that's what they talk to me about. But there is an obsession with this amongst the D.C., New York journalist class. And again, I think it's because it allows them to spin a narrative that they want to spin. They did not care as much about what happened after 2016 when you had a false Russia collusion conspiracy theory that was put on for years because they were involved when doing it, and how that may have damaged trust in institutions or all that. So I just think that it is what it is, but it's not something that I've been concerned about in my job here, because quite frankly, it's not something that most Floridians have been concerned about. They're concerned about their jobs, education, inflation, gas prices, all those things. And I wish the Congress of the United States would be concerned about those pressing issues as well. Sadly, they're not. They're going to use this to be able to get more TV time. And some of them who are probably the most loud, probably will end up vacationing in Florida at some point as well. Thank you.